morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right. Good morning. Welcome back to Insurance Matchmaking. I'm going to try to get, I don't know how the right way to say this is try to make something that's very confusing, try to make it a little less confusing. And I don't know, I'm not an expert on it myself, so it's going to be kind of tough. And kind of the way this got titled, The Hospital Trap, is what ChatGPT titled it. You know, how observation status can cost you thousands and what to do about it. And there are some things that you can do, and we'll kind of get into that. But the big thing, and I think I've mentioned it kind of briefly from time to time, talking about whether you're in the hospital as observation status or if you're admitted inpatient. And I can speak from my own example, was when I broke my knee. It was on a Saturday evening, so we went, the emergency room on Saturday evening, and they were going to, schedule surgery for me on Sunday, which actually was classified as outpatient surgery. So they put me in a room, but I was there under observation, just pending surgery. Couldn't eat or drink anything after midnight, and which really sucked because I didn't have a morning surgery. I ended up, surgery didn't happen till, I don't know, like 5 or 6, maybe even later in the evening. They kept having a couple emergency surgeries that there was only one surgery suite open. The surgeon was available, but they had surgeries that were more urgent, semi-emergency, so I had to wait for those. But I was able to go home sometime between 11 and midnight after the surgery. I don't think the surgery lasted very long. It was maybe a couple hours. They had to cut open my knee and put the pieces of my kneecap back together. So if you're listening to this, it's early morning for you. Maybe it's a little too graphic. And this was the example that I was given. So imagine your spouse spends 5 nights in the hospital, you come home, you recover, and then a bill arrives for $12,000. Not because Medicare didn't pay, but because of 2 words your doctor wrote in your chart, under observation. And so we're going to kind of talk about the things that's most understood, and one of the most expensive traps is that being, whether you're inpatient or whether you're observation. And so a lot of people think the doctor is the one that decides, I want you in the hospital as inpatient, and it's not. It's actually, it's driven more by the government, and of course, and then the hospitals themselves will, the doctor may just say, hey, I want so-and-so admitted as inpatient, and the hospital will go, oh, nope, doesn't meet the Medicare guidelines for that. And so you can be in the hospital and not be there as an inpatient. You're not admitted to the hospital. You're in the hospital. You're going to get a bill. They're going to charge you for services, but you're not admitted to the hospital. And I know that gets really confusing because you're in the hospital. Unfortunately, the way that it's come up, because CMS told they wanted to cut down on how many people are admitted in the hospital on Medicare, so they kind of changed the rules. So when it deals with Medicare, if you're in observation, that's not Part A of your Medicare. So Medicare Part A, you have, inpatient hospital. If you are there confined in the hospital under observation, that actually falls under your Part B. And so what happens there, and again, I'm going to kind of use the example, and again, this is one of those examples why we tell people, do not get just your Medicare, that, hey, they're sending my Medicare and you think it's free, and then you find out, well, no, there's a Part B premium that's going to come out of your Social Security, or you're going to pay a bill for that because you have to pay for Part B. And then there's some people who go, well, I'm not going to pay for Part B, so they say I don't want it, and then they only have Part A. And, well, that'll cover the hospital, but it's not going to cover observation, and it's not going to cover anything else medically. So you really have to have Part B. But we always tell everybody, don't just get Medicare A and B, the government portion of Medicare. Now, if you have a Medicare Advantage, it'll work a little different. But first off, I'm going to hit the example of you just have original Medicare. So if you have A and B and you're admitted in the hospital, currently this year, as you're listening to this, if you're listening to the original broadcast of this, it's 2026, and the Part A deductible is $1,736, $1,736. So that's what you'll pay for that hospital stay because you hadn't been in the hospital. That's the hospital stay. If you're inpatient. If you're under observation, then it's going to be covered under Part B. And so Part B is your Medicare's only, the Part B deductible is not a big deal, $283 this year. So, that's not going to rack your hospital bill up. But there are examples we use, the individual's in the hospital for 5 nights, and it's under Part B, and Medicare's only paying 80% because that's a Part B. So there's 20%. So that's how some of those charges can add up. If you have a Medicare supplement or Medicare Advantage, you're going to get help on those. You're not going to get that huge bill. But it's still going to have a lot of effect on you. And the biggest one is, and actually, before I get into that, I'm going to kind of go into how you end up in that situation, whether you're under observation. And so hospital billing departments kind of make that decision, or at least, when they fill out the billing, it's going to be who it is. But it can be retroactively reclassified through an audit. So like if the billing said, oh, you were inpatient, and then they come in and check the billing records and go, oh, this person should have been outpatient, and it can be rebilled. So yes, you can get surprise billed on that. That's one of those things you always have to watch it. So one of the things you want to make sure you do is always, if you're being confined in the hospital, ask them if you are admitted, are you inpatient, or you're under observation. Knowing that's not going to necessarily change anything, but it may affect kind of just how you look at how things are transpiring. Again, if you're inpatient and you know how your insurance is going to cover the inpatient, you're not going to fight to say, oh, no, don't keep me another night, or you're not going to fight that. You're not going to say, don't keep me another night, because you've already met the deductible, your hospital, your insurance is already paying for the inpatient, versus, hey, you might have more out-of-pocket costs on observation, so you may push that. In 2013, they had the 2 midnight rule, that if the doctor expects you to be in the hospital for at least 2 midnights, then they usually can justify getting you admitted as inpatient. So that's one of the steps the doctor can take. And then there are certain procedures that, like a cardiac catheter, specific surgeries can qualify as being for inpatient, and it's not related to the stay. So, like if you have to have a heart bypass or something like that, they're going to go ahead, that they will put you as inpatient. But, and again, I'm not a doctor, and there could be some heart procedures that aren't going to put you as inpatient. So don't say, oh, you said if I have a heart procedure, all heart procedures are going to be inpatient. No, I didn't say that. Sorry. But that's just kind of some examples that wouldn't necessarily have to meet that 2 midnight rule. So it could be something that you're hospitalized for that procedure, they keep you overnight, but you don't spend the next night. You might get discharged that next morning, or that later that day, that evening, or something, and actually able to go home. So the thing is, you can be, like I said, you can be in the hospital for 5 days and still be an outpatient. That's kind of the trap that I'm talking about. They do have to give you they have to give you the moon, a Medicare Outpatient Observation. Oh, I can't talk this morning. Medicare Outpatient Observation Notice within 36 hours of being placed into observation, which really doesn't help you out a lot there, because you've been there for 3 days before they actually have to give you that notice. They're required to give you that notice. They could give it to you the first day. They have to give it to you within 36 hours. Most patients don't know to look for it. So that's something you kind of have to look. So here's another kind of real-world example. Mrs. Jones falls, goes to the ER. They keep her for monitoring. 3 days later, she's sent to a rehab facility. As in, most people in the Cookeville area know about the Blue Roofs, but there's also places connected to, like the Livingston Hospital. There is a rehab there. I guess you could, even most of the nursing homes have rehab That's where you have that skilled nursing stay. You may be at a nursing home, but you're not in the nursing home. You're not yet. That's something we'll address, and we may not address that in this show, but we are going to address that again. But she's sent to that rehab facility, and then the bill comes. And because she was never formally admitted, Medicare doesn't cover that stay in the rehab facility. You have to have 3 nights. This is kind of similar to the 2 midnight rule, but you have to be admitted inpatient in the hospital for 3 nights to be eligible to go to the rehab facility and have Medicare paper. So generally, you maybe have a surgery and it's not considered an outpatient. I mean, some of those are now, used to be knee surgery, hip surgery, just kind of, you spent 3 days in the hospital and then you went to the rehab for another week. And now a lot of times they're outpatient, you're sent home. But if you have complications and the doctor might think they're going to send you for rehab, they need to keep you at the hospital for 3 days. And they know that. I mean, especially with Medicare, but I mean, it kind of applies to other insurance. It can run into that with other insurance also, but definitely with Medicare. The 3-night rule is hard and fast, or Medicare doesn't cover it. And that's the downside of a Medicare supplement. If Medicare doesn't cover it, doesn't pay anything for it, they say it's not an authorized charge, the Medicare supplement doesn't pay any of it either. So that's one of the big traps, one of the big gaps when it comes to Medicare. Now, if you have a Medicare Advantage, sometimes they will pay for the rehab facility because they determine that it could be determined medically necessary, and they're charging you, or they're covering it and not requiring that 3-night stay in the hospital. It's very rare, but that's the other thing too. I talk about the pre-authorizations that you need with a Medicare Advantage, and one of those is being discharged from the hospital requires a prior authorization. And I just kind of jokingly say that if they're sending you home, no, your insurance doesn't have to say no, they can't. You can't go home because they don't want to pay for another night at the hospital, but they do have to prior authorize you moving to the skilled nursing facility. So if something happened, you didn't have your 3 nights, but your doctor wants you to go to the skilled nursing facility, the Medicare Advantage may authorize it. Very highly unlikely, but they can. The other thing is they're going to cover, the same thing with the Medicare supplement, will cover those Part B expenses for the observation stay, but you may be paying a high copay. Typically with a Medicare Advantage plan, high outpatient procedures or outpatient surgery, an observation stay would kind of fall into that same category when it comes to the billing. And they usually have, a $250 to a $400 and some dollar copay for like an outpatient surgery. A lot of times your outpatient surgery copays are close to or are the same amount as that per day in the hospital copay, because you're going to have a copay for days in the hospital also. So if you're in the hospital for 5 days and your Medicare Advantage plan has a $300 per day copay, you're going to pay that copay. And a lot of times they will cover an observation stay the same way. It just depends on the plan. Some of them will do that. Some of them they'll categorize it as an outpatient procedure. But again, your copay is going to be about the same. But if it's the outpatient procedure and not a hospital stay, it's not going to cut off after that 5 days or 6 days, whatever your plan says for hospital stay. It will be however many days you're there under observation. And again, I don't really think it'd be very rare for someone to be in the hospital under observation for more than 5 days. Something like that should get reclassified to inpatient sometime during that period. You may have still started out 2 or 3 days under observation and then be admitted. Maybe your condition worsened, things like that. The other thing is the skilled nursing, kind of getting into that. I know I think we've talked about it recently, but once you're in that skilled nursing facility, you had to have your 3 nights, and then when you're in there, you have to be improving. If you're getting worse, then they're either going to say move you back in the hospital, or if you're not getting worse, but you're not getting better either, they're going to say, well, this person could recuperate at home because they're not getting better, they're not getting the physical therapy. Physical therapy treatments there. And that's one of the reasons they want you in the skilled nursing facility, because a lot of times the physical therapy may maybe two and three times a day, after a certain surgery or a certain injury. So you're right there. That can come in and maybe they need to do different types of therapy, work on your leg, this hour, and then come back in a couple hours and work on your shoulder or something like that. Just depend, who knows? I know I'm getting all these scenarios, but the point is, yes, they're going to be able to handle your therapy and things better if you're in the skilled nursing facility. But then you have the flip side for the patient. A lot of people would prefer to be able to recover at home. Your insurance will cover home health, and let's say I'm maybe getting ahead of myself, but I'm probably going to come back to that. Let's take a quick break here.
This summer, Twin Lakes is turning up the excitement with the 10 Gig Days of Summer giveaway. That's 10 days, 10 incredible prize packages, and 10 chances to win big with a new prize featured every day. Enter June 23rd through July 16th at twinlakes.net. Winners will be announced on the Twin Lakes Facebook page beginning July 7th, with a grand prize winner revealed July 16th. Don't miss your shot at a summer full of big wins. Visit twinlakes.net to learn more. Lace up your running shoes and celebrate the 4th at the 28th Annual DeKalb Fiddler 5K, July 4th at 7 a.m. in downtown Smithville. Rain or shine, be part of one of the biggest weekends of the year during the Smithville Fiddlers Jamboree, while supporting Upper Cumberland Habitat for Humanity. This timed race is also a qualifier for the Run for the Cumberland Medal Series, so bring your best. Run, celebrate, and give back to the Upper Cumberland Habitat for Humanity at the DeKalb Fiddler 5K. For more details and to get registered, visit uchabitat.org.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, we're back in Insurance Matchmaking. So there is kind of a domino effect, what you lose in your observation. And it's not really just a billing technicality. There's just different rules that go along with it. But the four main consequences, and I think I'm going to list them, and then I'll go back and explain them. And I don't know that. The way this is going, we may continue this and do a second show. So next week, that may be a continuation of this. I'm not sure if I'm going to finish this subject. But Part A versus Part B billing, I maybe already kind of addressed that. Prescription drug trap, skilled nursing facility coverage killer, and again, I kind of touched on that. I'm going to come back. And the 100-day myth revisited. And the reason is, like I said, you've heard me, if you've been listening to me for a while, I like to use ChatGPT to kind of help me have the talking points. And the great thing is like, hey, what haven't I covered lately? And that was actually basically what I said. And it's like, well, you've kind of teased this subject, or you briefly touched this, but you said you were going to come back, and talk about it some more. So that's kind of what we're doing this morning. This is one of the subjects that Chat said, hey, you might want to go a little more in depth in this subject. So AI can be helpful. So the Part A versus Part B billing, like I covered that. You have the 20%. So if you have just original Medicare, you're going to pay the 20%, and your room and board, since you're not admitted inpatient, may not be covered at all because they're observation. So any health care you're receiving in the hospital, but your meals and the room charge may not be covered by the insurance because you're not admitted, which I think is crazy, but I'm not the one that writes these rules. Those are the things. That's when you talk to your congressman or something and say, hey, you guys need to fix this. The prescription drug trap. Again, when you're admitted in the hospital, your prescriptions are covered under your being admitted. Well, your Part D drug coverage with Medicare is considered outpatient. So if you're under observation, your drugs are outpatient, and they generally won't let you bring in your own medication. So they're going to bill you, and that's where people have talked about, that $500 aspirin. It's that they can bill you under Part B or just bill you for your prescriptions. And so you could, those could be some costs too. So there's not a lot you can change on this, once you're in the hospital, but at least to kind of have you be aware of what's happening. The skilled nursing coverage killer, as this was titled, and I mentioned Medicare only covers skilled nursing facility after a qualifying 3-night inpatient stay. Observation nights do not count. And you could be discharged to a skilled nursing facility after an observation stay, and you're 100% out of pocket for, say, $300 to $500 per day. So that's how those bills can really add up. And this is probably one of the most financially devastating consequences for seniors, because they're not aware that their insurance is not covering that stay. And then we're also going to talk about the 100-day myth, and that is a lot of people think, well, skilled nursing, as long as I had those 3 nights in the hospital, Medicare is going to cover me. Well, they cover the first 20 days. Part A will cover the first 20 days of your stay. If you have a Medicare supplement like a Plan G or a Plan N, days 21 through 100, currently it's like a $218 copay. And I'm pretty sure that is the Medicare amount, because I was looking at Medicare Advantage plans yesterday, was doing a comparison for somebody, and all 3 of them, the copay for days 21 to 100 was $218. So I'm pretty sure that is the charge this year that Medicare says you have to pay. If you have a Medicare supplement Plan G or Plan N, they will cover that $218 copay. Part A does not. If you have a Medicare Advantage charges that as a copay. So it goes towards your maximum out of pocket, and you could hit that maximum out of pocket before your 100 days are up. But you're going to have a copay for $218 a day that your insurance is going to bill you for. So that's kind of the myth there. But after day 100, Medicare doesn't cover anything, and Medicare doesn't cover it, your supplement doesn't cover it, and Medicare Advantage does not cover after 100 days either. That's one of the things have talked recently about. We do what's called our umbrella coverage, and that's one of the things we attack through like our recovery care option on the umbrella 3, and that is after day 100, it will start paying you for that confinement so that it's not eating up all your savings. So that's something, again, get with us if you are concerned about that. And it got a couple different options. When I say recovery care, the plan that covers that is kind of a tough underwriting. You have to be in pretty good health. You can't, the way these plans are geared is if you can't do 2 of the 6 ADLs, as they're called, the activities of daily living. If your doctor writes a notice that you cannot do 2 of them, you can't, you're unable to dress yourself or get yourself on and off the toilet. Those are things where you need assistance with those things now. That would qualify, and you could go on claim and use those plans. If you already in that situation, you can't get the plans. Then we call the home health plans. And they're called home health, and it's again a little bit confusing. Home health care is covered under Part A, but that's only for an hour or 2 where a nurse or a physician's assistant comes in and treats you, whether it's checking your vitals, changing a dressing, maybe a sponge bath, but that's all they do, and they're only there for an hour or 2, and then they're gone. And it may not be every day. A home health aide is someone who comes in and helps you around the house. They help you get dressed. They help you get out of bed. They help you on and off the toilet. They cook meals for you. They may even do your laundry and some light housekeeping. That's not covered by health insurance. I started to say that's not covered by insurance, but we do have insurance plans that cover it. But your Medicare doesn't cover it. Your Medicare Advantage doesn't cover it. Your Medicare supplement doesn't cover that home health aid, but we do have plans that help cover that. As I mentioned, the recovery care is one. Recovery care is more of you're confined somewhere. They do have some home health like riders on the plan, and then we also have the short-term home health plans. I got several different carriers that cover that, and those plans will the home health plans are generally pretty easy. If you haven't been in the hospital in the last 3 months, you can still do all 6 of your activities of daily living. And here's the big kicker. This is the one a lot of people are in great health physically, no diabetes, no heart issues, but once you have cognitive impairment, you can't get these plans. If you have the plan, that is one of the things that triggers that you can go on claim and start using the benefits. So the home health plans are great because they help you stay in your home. So one of the things that talked about is I did skip something I wanted to share. A 2015 study found that more than 600,000 Medicare beneficiaries were affected by observation status in a single year, and those numbers have grown since CMS tightened inpatient admission rules. So like I said, it's not your doctor that's making you go outpatient. It's CMS. It's the government. Big bad government, not the doctor. You kind of and don't blame the hospital. They're just enforcing the rules. They have to, because if they don't enforce the rule, then CMS says, well, you're not doing what we told you to do, so we're not going to reimburse you for anybody that on Medicare that stays in your hospital. They can't afford to do that. They close up. So don't get mad at the hospital because you run an observation, but be proactive and find out what your situation is. But that was one of the things that talked about. The hospital indemnity plans, the recovery care and home health plans. Talk to us about the umbrella coverage, what we call the umbrella. We call it umbrella coverage. It's not official. I know, I may offend some of my PNC friends out there in the home and auto insurance world because they do sell umbrella policies. Those umbrella policies are a liability coverage that keep you from losing your home because you get sued, whether somebody fell on your property and they sue for more than your homeowner's insurance, or you're in a car wreck and they sue you for more than your car insurance covers. You have a plan and they'll cover that. That's a true umbrella policy. But we're using the umbrella here in that figurative sense. We want to make sure that you have more coverage, and so we do have these listed as Umbrella 1, Umbrella 2, and Umbrella 3. Umbrella 3 is the most comprehensive, and it's going to cover – it's like one of the things we talk about, heart attack and stroke. That's one of we call them the big three of those things that, if you have a Medicare Advantage plan, you probably hit your maximum out of pocket if that happens. One of those conditions happens while you're that year. And that's why we recommend that everybody get at least an Umbrella 1, especially, and then Umbrella 2 will include what we call a HIP, or that copay protection plan, the hospital indemnity. I recommend that for everybody that's getting a Medicare Advantage because I talked about, that observation stay, those skilled nursing copays, those things are going to rack up on you, and you may not need them now. You may be in great health, hey. The only reason you're on old people's insurance because you are old now. You turned 65. And if you're new to listening to this, I'm 67. So I can say if you're 65, you're old. And I'm not being condescending. I am old. Actually, looking on Facebook, my daughter's college roommate was talking about, I'm growing out my hair and I'm noticing more gray. And I wanted to say, welcome to middle age. Because we see our kids, it was like our kids are in their 40s now. So they're middle-aged adults, not kids, but we still call them our kids. So when I talk about people being old, I feel like I'm talking about my peers, so I don't feel like somebody shouldn't take that like an insult. But we've talked about those HIP plans, and they will reimburse because I was talking about, if you go in the hospital, you're going to have usually around about $300, and some plans even more, copay for those, 5 to 6. I'm trying to think, one of our local plans here, it's like 9 days. I don't write that plan, but if you did decide that was a plan you wanted, you really need to consider a hospital indemnity plan, and then you have that maximum out of pocket on those plans that. We've got plans that are around $4,000, $5,000, but they can be all the way up to $9,250, I think it is this year, is the max out of pocket. And that's for in-network care. PPOs can have a higher max out of pocket for out-of-network care. And it's very common for the plans to be around $6,700. So you have a catastrophic event, you may hit that out of pocket. Now, just a long hospital stay won't necessarily hit the max out of pocket. All right, and I went over time.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.